for public health coming together in a divided world. It's a real pleasure to join all of you today. I'm Dr. Celine Gounder. I'm an internist, infectious disease specialist, epidemiologist, as well as medical journalist. I'm a senior fellow and editor-at-large for public health at KFF Health News, a CBS News medical contributor, and the host of two podcasts, Epidemic and American Diagnosis. I'm also a clinical associate professor of medicine at NYU and Bellevue Hospital, and I'll be your moderator for this session. We are all acutely aware of the complex challenges confronting public health today. These range from workforce shortages and reduced legal authority to dwindling emergency resources for public health emergencies, like pandemics, and a worrying decline in public trust. This election season, we observe an alarming trend where numerous political candidates from local to national levels are endorsing anti-public health policies, voicing anti-vaccine opinions, and propagating disinformation. Our field stands at a pivotal crossroads, necessitating a shift in our approach. Today's panel unites distinguished thought leaders dedicated to exploring effective strategies for public health professionals to respond to these challenges, drawing on both past experiences and ongoing learning to pave a new way forward. With this in mind, today's conversation is intended to be interactive. We'll divide the conversation into three segments, each focusing on a distinct topic. We will begin each segment of our conversation by watching several video clips. You'll see video clips from two focus groups that were conducted with American voters who self-identified as being skeptical of public health. One focus group included those who self-identified as Democrats and Republicans. The other focus group only included those who self-identified as Republicans. We will use an online platform called AHA Slides to ask you a few questions and to quickly get your reactions and responses. To get connected, scan the QR code on the screen or go to ahaslides.com 3WMWQ. And I'm just going to give you a few seconds to capture the URL or the QR code on the screen. Lastly, before introducing our panelists, many of you received a copy of either Community Engagement or Policy Engagement. These books are the first two volumes of the highly acclaimed Strategic Skills for Public Health Practice series, offering essential skills for health practitioners to effectively navigate today's complex public health landscape. Okay, now let's introduce our panelists. We are joined today by Dr. Brian Castrucci. Dr. Castrucci is the president and CEO of the de Beaumont Foundation. He has previous experience working in health departments in Georgia, Pennsylvania, and Texas as an epidemiologist and public health practitioner. Our next panelist is Mayor Greg Fisher. Mayor Fisher was elected Louisville's 50th mayor in 2010 and completed his third and final term in office on January 1st, 2023. Using his background as a successful businessman, he led Louisville through unprecedented economic growth while simultaneously prioritizing equity and racial justice. During his tenure, Mayor Fisher collected numerous awards and recognition, including Public Official of the Year from Governing Magazine and America's Most Innovative Mayor from Politico. Our next panelist is Dr. Jerome Adams, Presidential Fellow and Executive Director of Purdue's Health Equity Initiatives at Purdue University and former U.S. Surgeon General. Dr. Adams is a licensed anesthesiologist and has a master's degree in public health and ran the Indiana State Department of Health prior to becoming Surgeon General. Our next panelist is Jessica Malati Rivera. Ms. Rivera is a science communications advisor at the de Beaumont Foundation and also an internationally recognized researcher and infectious disease epidemiologist. Her specialty is in translating complex scientific concepts into impactful, judgment-free, and accessible information for a diverse audience. And finally, rounding out our panel is Dr. Abdul El Sayed. Dr. El-Sayed is the Director and Health Officer for the Wayne County, Michigan Department of Health. His public service focuses on health equity, resilience, and environmental justice. He also ran for governor of Michigan in 2018. If you aren't already, be sure to check out his America Dissected podcast, where Dr. El-Sayed invites tens of thousands of listeners to explore the intersection between health and society with him and leading experts in science, public health, healthcare, public policy, and politics. So thank you, all of you, for joining us today. And let's jump into our first conversation, politics and public health. So let's watch the first of our video clips from our focus groups with voters.
I would say the CDC is a figurehead for something that's supposed to be good, but it's really run by politicians and pharmaceutical companies, and they follow where the money goes or where the political wave is headed. That's where they follow, and that's how they change their story to monopolize on that.
I think that pre-pandemic, Frank, I would have said public health meant something different to me. Post-pandemic, it means has a new definition. It has a definition that is both politically and ideologically driven, agenda driven. And it also says to me that I can't trust what's being told to me because, quite frankly, I don't believe it, and I've been proven to be right. So I have a far different definition of it now than I did pre-2020.
Our society today is so polarized and politicized that we can no longer think about community and think about keeping people safe.
What I will say is what everybody else has said is to divorce the politics from the data and the science. I'm not saying it's an easy task because it isn't, but that is key because we're all in the same boat. We want to be safe. We want to be healthy. We don't want to die. And it's a sense of community is important.
Stop appearing with politicians. Don't appear with elected officials. Don't appear with party people. Have your own press conference with your own people and say, look, this is as non-political as pancreatic cancer. However you guys are going to deal with this. But this is the reality. And don't be with politicians, because the minute you do that on either side of the aisle, people are going to look at you in a negative or a suspicious light.
So now we have a question for all of you in the audience, and use your phones to respond. Again, the URL and QR code to connect to the question is on the screen. Our first question to you is in one single word. How did this video make you feel? So it looks like frustrated is a big sentiment here. Sad, discouraged. Annoyed. Yeah, frustrated is really rising to the top, isn't it? So I'll start with you, Mayor Fisher, and Dr. El-Sayed. You have both run and engaged in campaigns. You've talked with and worked with people who love you and who hate you. How do you communicate across these divides? Maybe starting with you, Mayor Fisher.
Well, that was a good excerpt there of the non-believers, if you would, right? I mean, that's just the reality of the world that we're living in right now. So if there's anything I learned in 12 years as being mayor, I mean, there's like forces of good, forces of evil, forces of dark, forces of light. And if you think you can just kind of lay back and common sense and goodness is going to win the day, then you're kind of in the wrong business. And you might say, well, I didn't sign up for that. You know, I'm a scientist, I'm a doctor, I'm a guy that just wants to get things done. That's not the playing field right now. So how do you establish these relationships before you need them? And how do you look at that as part of what you do? So you might have a new definition of what your job is. Communicator, networker, partner, and all of that will pay massive dividends when you need that, because you have to have that level of trust. Obviously, we've all been through the trauma of COVID, and nowhere was it more clear than during that episode. And what we did was communicate consistently with a variety of people, some that came from whatever tribe you might belong to. So you could start saying, well, if they're saying it, maybe I need to be open to it. And then, of course, once we went through COVID a little bit, some of the deniers who had either had near-death experiences or actually had family members that died, all of a sudden they became part of the converted. So broaden your job view so that it's more than just a focus on, let's say, solving one problem. It's a much bigger constituency that you've got developed so that you can bring people in, identify their point of ownership, and then have them be part of the solution and part of the evangelist that you need.
So let me pick up where the mayor left off. I've never served as an elected official, but in my role as a health director, we spent a lot of time trying to get out into the community. But I think one of the frustrations with how folks feel about public health is that COVID was the first time they've ever had to actually interact with the health department. And that's a function of what we in public health have thought of our role as being. And it's also a function of what our system of politics has rendered public health as doing. And I think you talk to a lot of folks, and we were having a scientific debate about whether or not you should have a vaccine. And the scientific part of the debate is clear, but the political part of the debate was not. But here's the challenge, is that we have failed to inoculate our communities against disinformation because we're not solving problems that folks clearly know they have. So if you have diabetes or somebody in your family has diabetes, you need insulin. There is no question about that. And without insulin, but for insulin, you have a risk of passing away. And the hard part is we're not having a political debate in a lot of spaces about whether or not we should give people insulin, or at least we're not winning it. And so if you're someone there out in the community and your understanding of science and medicine and public health is one that's informed by the notion that our politics don't deliver something you or your community clearly need, then when it comes down to trying to reach out to those same folks and say, hey, we've got a really important solution to your potential risk for getting COVID, they're just not that likely to listen. And if you look at the predictors of folks who held beliefs like this, they tended to be people who were uninsured. They tended to be people who held medical debt. They tended to be people who felt underserved by our healthcare and public health apparatus in the first place. And so if we're serious about getting people to listen to us in these moments of crisis, about inoculating them from the mis and disinformation out there, we've got to be about solving baseline problems that existed well before the pandemic and sadly look like they're about to exist well after the pandemic.
So I have a follow-up question for both of you, as well as Dr. Adams, if you'd like to jump in. So back in April of 2020, I actually wrote an op-ed on this very topic of politicians should not be the ones talking about these issues. It should be doctors and nurses and scientists. But you do, at some level, as a political leader, as a leader in your community, have to speak about these issues. So how do you do so without contributing to further political polarization of public health? Mayor Fisher, if you want to take a
I think
stab
it's
at it.
all about partnerships, right? So let's say in a mayor's office, Louisville's a city of about 800,000 people. The mayor has strong convening power. So who do you bring into a challenge like this to depoliticize it? Look, mayors are from the political party of getting things done. You rarely identify as a Republican or a Democrat, and clearly in a crisis like COVID, it was very clear. There was an enemy. It was COVID. The protests were going on at the same time, which made all this very difficult, right? Because with the protests, it wasn't like, okay, defund the police, knock the protesters on the head. Nobody was saying, let's give COVID a chance. Maybe COVID's got a good point here, and maybe we should welcome COVID into our society. That was clearly not there, so that was good. So you bring together your hospital community, your scientists, people from marginalized community, and really create that then as the nerve center for what your city is going to do. The mayor just happens to be the convener, and because that's the position that person holds. So use that to depoliticize, broaden the group so everybody has a seat at the table, and see somebody that looks like them or that they can identify with to catapult the activity forward.
So lead by convening. Dr. Adams, Dr. Al-Sayed, anything else to add?
Well, I'll jump in really quickly. And the mayor and I were having this conversation earlier. One of the things that I try to help people understand is that all health is local. And there was, for many reasons, a misperception that changing who was at the White House, changing who was at the CDC, changing who was at the FDA was going to massively change our COVID outcomes. But a point that Brian Castrucci makes that I actually quoted in my book is that your governor and your mayor have more control over your health than what your doctor does. Constitutionally, most of our health authority and most of the relationships that we form that impact our health occur at the state and the local level. And we actually have data to show that changing who was the captain of the Titanic didn't change the direction of our ship. October 2020, Joe Biden and Donald Trump had a presidential debate. Joe Biden said of the 200,000 deaths that occurred at that time, any president responsible for this many deaths should no longer continue to serve. And many of you all in this room said exactly right. Fast forward to October of 2021, we'd had about 300,000 deaths under the new administration, despite vaccines, despite masks, despite testing. You go to October of 2022, we were over 200,000 deaths again. And this isn't to criticize Joe Biden or the Biden administration, it's to say that we're not paying attention to the real fundamental root issues that are causing us to continue to have our problems because we're focusing on partisanship. The final thing I would say is health is inextricably political. There's just no way you're going to separate it out. When you look at women's health, when you look at guns, when you look at drug policy, when you look at universal access to health care, it's inextricably political. What I contend in my book is that we have to do our best to make it nonpartisan. We have to understand there are political tools that we can bring to the game, but we have to try to make it nonpartisan. I still practice medicine. No one has ever come to me and said, Dr. Adams, does Donald Trump think I should get a pap smear today? But that was the way the media came to me every single time I had an interview in 2020. What do you think about what Donald Trump says about this? What do you think about what Joe Biden says about this? As opposed to what does the science say we should be doing about it? And I think we have to recognize our own bias. We have to recognize the bias that's being projected upon us by Fox and NBC and CNN and Newsmax. And we need to try to be nonpartisan to the extent that we can control it. And we need to demand that the folks presenting us information are doing it in a nonpartisan way.
I want to just pick up on where you left off. 2 points. That same person who was in this focus group saying that the doctors shouldn't appear with the politicians, I could imagine them in another breath saying, we should not be leaving it to unelected bureaucrats to make decisions. Yeah. So at some point, right, we got to decide, are we talking about elected officials or are we talking about politicians? Because every elected official was once a politician. And so that is important because in a democracy, we do elect our leaders. And those leaders are supposed to set the standard, and you want those leaders leading on the number one most important issue. So that's one point I don't want us to lose sight of. You know, when we talked about partisanship versus political, I think it's a really important point. I think where we tend to fall off, and I want to shade both sides of this debate here so we understand exactly what the stakes are. Because I agree with you, we should not be partisan as much as we should be political. Politics is about how we allocate scarce resources. The hard part is that when you talk about this, and particularly when you talk about health, oftentimes you're talking about a core nucleus that truly is bipartisan. Should some people have health care in America? Everybody be like, yeah, of course. The challenge is who gets left out on that, should other people get health care in America? And that tends to become a very partisan question. And so when we talk about it being nonpartisan, we have to actually say what we're talking about. And oftentimes when you talk about a nonpartisan version of this, what you're talking about is, are we including things like health equity? Do poor people get access to health care? Are we willing to invest in fundamental access to critical medications for everyone, not just folks who society deems as being worthy? And because of the system of structural racism, that tends to include some people and not others. And so I think it's important for us not just to say we should retreat to the least common denominator of what makes us nonpartisan, but instead We need to push so that we have bipartisan consensus on these other points. Otherwise, we always end up leaving out folks who tend to have gotten left out for a very long time and look like they're going to be left out in the future.
I don't want to slow you down, but I want to give you a concrete example of trying to be nonpartisan. I get Indiana. I was the state health commissioner of Indiana. We were one of the first red states to accept Affordable Care Act funding to expand Medicaid, a fight that we are still having. We got ripped to shreds for it at the time by people on the right and by people on the left because one side thought we went too far, the other side thought we didn't go far enough. But I had to do interviews and they would say, so you support Obamacare? And again, I was appointed by Mike Pence. And so what I would always say in a nonpartisan way, because that's an incredibly loaded statement just in the way it's asked. And a lot of times that's the point I made about you don't understand how you're being led down a pathway, even the way the question is being asked. I would always say, look, I agree in high quality, affordable health care for everyone. And when you say it that way, Republicans can't argue against it, Democrats can't argue against it, independents can't argue against it. Who's going to argue against high quality, affordable health care for everybody? That is the way I would always approach it. And the media would always say, but you agree with Obamacare then, right? They wanted the soundbite. They wanted the clip. And I think it's incumbent upon us to recognize when we're being pushed down a partisan pathway, a partisan framing, and to try to depoliticize it as we talk about these important issues. And that happened over and over again during COVID. You'd say mask, and it immediately invoked, and it was framed in a way that made you think you're either supporting Biden or you're supporting Trump. Vaccines, you're either supporting Biden or you're supporting Trump. No, I'm supporting the science, and I would take pains to actually stop an interview and say, here's what the science says. It actually became my tell, and Celine will tell you, the reporters actually make fun of me because they're like, Dr. Adams, we know when you're trying not to answer a question, because you would say, look, here's what the science says, and that's not where they wanted you to go.
And by the way, Jerome was the only one of us wearing a mask backstage, and he's done a very good job, I will say, of role modeling wearing of masks on public transportation. It's all over his Twitter. So thank you for that. Dr. Castrucci, these focus groups were commissioned by the de Beaumont Foundation and facilitated by Frank Lutz, a very well-known conservative pollster. You've used focus groups like these to provide insights to public health professionals, elected officials, and others throughout the pandemic. What have you learned overall from focus groups like these?
Well, I think what we've learned is that we need a new playbook in public health. We have to do things differently. And often we lead with our values in public health, and we really need to keep centering the science. And I think you've already heard some amazing things from the panel. Your partnerships and messaging. This is so clear because the folks in the focus group really believe that CDC closed schools. They really believe that CDC closed businesses. And the last time I checked, CDC does not have that authority.
Right.
And we also have to understand that we did harm. I'm not saying we didn't make the right decision. I believe in the lockdowns. I believe in the policy decisions we made. But that doesn't mean that there weren't harms done to people who spent their whole life trying to open a business, and that business never opened again, right? So we need to be empathetic to those groups. And again, on the partnerships, I mean, it's amazing, right? Somewhere in this country, a health commissioner met with a business leader, and they'd never met before. They introduce each other. And then the business leader says, hey, what brings you here today? And the health commissioner says, oh, I'm here to shut down your business for the next 2 weeks. That's a bad first date. You're not swiping right after that. and I don't blame them, right? Because we didn't have the relationship. We knew, everybody in this room knew, that we had a respiratory virus out of containment. You needed to start to call businesses and faith community and say, buckle up, Buttercup, this is gonna get bad. And I'm your point person, and I'm going to be with you. And I don't think we should be necessarily just with the politicians. We need to have, when public health people are speaking, you need to have the politician, but you need to have the faith leader, you need to have the doctor, you need to have the business leader. Remember, when you look at who Americans trust, they trust their employer. They don't trust government, they don't trust media, right? When you look at who Americans trust, they trust their physicians. Yep. So we need to leverage those people. We need to really find the messengers in our communities, because if you have the best messages delivered by the worst messengers, you're not getting forward. So for some people, Mayor Fisher was a great messenger. For some people, Jerome was a great messenger. But for some people, they needed someone different. And that's the strategy that we have to engage in now before the next pandemic starts.
And I'd love to get Jessica's perspective as a comms expert, because you brought up something critically important, and that's our tendency to want to shame people who don't agree with our position. And for those of you who follow me on Twitter, I've got a tweet that went viral yesterday about my interaction in a cab yesterday with someone who is currently unvaccinated. And I said, did you get your flu and COVID vaccine? And she said, hell no, I'm not putting that poison in my body. And we proceeded to have a conversation in the cab. And it's fascinating when you look at the replies, because there are so many people that are like, I hope you gave her 0 stars. I'm like, seriously, and that was the response. That's the response we had. One of the most harmful statements, and many of you all will disagree with me, but I would contend from 2021 with pandemic of the unvaccinated. There are people who have, for decades, had good reason to distrust government and medicine. We are not going to dispel all the reasons that they have to be hesitant in a few months. And when you say pandemic of the unvaccinated, you are blaming them for the pandemic. You're blaming them for the harm that everyone is experiencing. Oh, and guess what? We found out a few months later that the vaccines weren't so great at stopping transmission, so it looks like we were lying on top of shaming. But your perspectives on communication?
Yeah, I think it's a very important point. Before I became a comms expert, I was really heavy into the science of infectious diseases. And for many folks in this space, we knew it was a matter of when a big pandemic, a disruptive pandemic would emerge. And for those of us who were comms people at the same time, we thought, we have to get ahead of this. We have to start doing a lot of the information inoculation, doing the kind of anticipatory messaging, helping people elevate their science and data literacy, even their media literacy, to anticipate what usually happens after an outbreak, which is an outbreak of an infodemic. They go hand in hand. It's sometimes too much information, mis and disinformation, and then you have to remember the emotional intelligence side of this. You have to remember that these are people with different experiences, different histories, different traumas, very real traumas, that for the longest time we have been treating the public, the American population, as a monolith, and not seeing the fact that it requires sometimes code switching. It requires sometimes different mediums for effective communication that will actually penetrate communities that might be hard to reach. And I think that it was a bad thing for public health that the emergency made public health so kind of part of people's regular lexicon in the last few years, because it's so much more than emergency response. It is everything, right? So considering the fact that public health didn't do a really good job with PR prior to COVID to normalize things like, we have speed bumps and grades on restaurants as all part of this public health infrastructure to keep people safe, not to mention the fact that for the longest time, science has been very distant from the average person, and it has been a bit gate-kept by folks who don't always look like people who are receiving the information. It stays in very fancy institutions, behind lab walls, in very hard-to-read peer-reviewed journals, and people are thinking about the communication side of it as an afterthought, and that has done us a huge disservice. Even early in the pandemic, folks of us who were screaming about the need for SciComm and why aren't we thinking about a message program and Operation Warp Speed for messaging to turn vaccines into vaccinations, because we know that trust is how that happens. It was kind of balked at. People thought it was just kind of a cute thing to do on the side, like it was gonna just it was just gonna appear when states were then given these massive, shipments of vaccines and said, get them into people's arms. So we have a lot of work to do on the trust aspect. We have a lot to do on repairing trust, which will take a lot longer than how quick it was to destroy it. And I think that when we realize that as diverse as our community is, so should the diversity exist in the messengers, the people who are policymakers, the people who are sitting on panels and talking about these issues, because otherwise it's going to continue to make those gaps much larger.
Abdul, did you want to add something, and then we'll move on?
Yeah, I just want to pick up on this point, because I'm a sucker for those like cheesy sports quotes. So one of them, Vince Lombardi quote is excellence is not a some of the time thing, it's an all of the time thing. Public health is not a some of the time thing.
Yeah.
It's an all of the time thing. And I'll be honest with you, and I'm gonna go off script here as conveniently sitting on the left of the panel. One of the frustrations I have is that we talk a lot about the before pandemic. Well, we were not prepared. We had not invested in public health. And the worry I have, to your point, Jessica, is that If public health is an all the time thing, what are we doing on the after the pandemic, right? And the challenge here is that we have an opportunity of a once in a lifetime pandemic, and everybody seems to want to run away from what just happened. And in some respects, you think about the administration currently in play, rather than declare the thing over, shut the door, and pretend like nothing actually happened. This was the opportunity to be invested in the baseline public health that we should have had. And I worry that that door is closing. It is closing quickly. And unfortunately, right, politics comes in cycles. And we're having these conversations, and nowhere is there a debate about whether or not we actually want to invest in the public health system that we need and deserve in this country, lest we find ourselves in another before the pandemic moment where we're like, well, damn, how do we miss that opportunity?
Right.
And that's the question we all should be asking right now.
Right.
And just to add to that, I mean, I think when you see the focus group, you see this just guttural lack of trust. And I just, what keeps me up at night is right now, let's say bird flu takes a bad turn and starts offing people. Who even tells the American public that bird flu has become dangerous to the American public? It's not Joe Biden, because if you say it's Joe Biden, then it's going to be about stealing another election for those who believe that. It's not going to be CDC. So like who gets to stand at the podium and go, we're in trouble, bird flu has become, bird flu is now killing people, and we need to do these things. And when I look at the focus group, I just didn't know who that person is anymore. And that scares, it should scare like all of us, that just our toolkit as public health practitioners has shrunk throughout this pandemic. We are less prepared today than we were at the start of the pandemic, and I don't know who leads us through the next one.
Well, Celine is going to kill us here because we're going completely off.
Brian.
But I would actually say that that it's not nowhere that we aren't investing. In Indiana, you can look it up. There was a Politico article that came out in June. We increased our public health funding by 1,500% in conservative, red Indiana, $250 million additionally invested in health. And Jessica talked about the need to sometimes code switch. Look it up. We're going to work with CDC Foundation and Judy Monroe to try to go to other states and help them understand what we did. We did not talk about a lot of the things that we talk about here at APHA. What we talked about was workforce. We talked about how at a time when you can't find enough people to staff anything, that we need to have healthy communities and we need to invest in women's health. We need to we need to make sure we're not falling behind on childhood vaccinations. We need to invest in clean water and lead abatement. And we were able to do that by working with the business community to make the workforce case for public health. So to your point, Brian, I actually think, and Brian knows, he worked with me, I put out a report when I was Surgeon General that was the first of its kind, and it's called Community Health and Economic Prosperity. And it was the first of its kind because it wasn't written for a health audience like all other Surgeon General's reports are. It was written for a business audience. It was making the business case for health. And as you mentioned, employers are people who are trusted. The government telling you to go get a vaccine? No. Your employer saying, hey, we need to do this so that we can keep the workplace open. People are more open to that. And so I think we really need to leverage and lean into employers, particularly local at the community level, to help us make that case for public health through the lens of it's supporting a healthy and productive workforce.
The reality, this is much bigger than a public health issue. And this is where when you find your hospital systems coming together, your business systems coming together, what I described earlier in Louisville, on top of the protest. Why is that important? Because a lot of white folks in particular didn't understand what was at the root of the protest. Okay, we might be talking about racial justice issues, but we're also talking about housing, healthcare, education. Some of these larger societal issues that have not been addressed that lead to this disproportionality in wealth and income that we have, which we all know leads to a predictor of zip code and life longevity that just really is not acceptable if you want to lead with the human value that we talk about before we get into any of the politics, right? So there's an opportunity when people start saying, what is this social determinants of health thing? Where people are hearing that for the first time. How do you take the momentum from COVID into progress on social determinants of health, community-wide? And what you did see, again, after protests, is you saw organizations that had never invested in communities of color or marginalized communities come in and want to understand more exactly what's going on. Is it perfect? Absolutely not. Was it pretty unprecedented? Yes. So those are things that we can build on to put this bigger picture out there where everybody deserves a certain safety net level that provides the basics that a lot of people in our country still don't have. So while we're talking about public health, these are bigger political issues, Doc, I guess you would say, that we've got to look at folks running for office, because that is where resources ultimately are allocated. Big money from the federal level, smaller from the state. At the local level, it's just about operationalizing. You don't really have a lot of money that you can deal with. But who we put into office really matters. What values they have really matters. And that's why, citizenship is a contact sport. You can't sit on the sidelines and say, I'm not going to vote. That really is an egocentric abdication of one of your fundamental responsibilities that you have.
So I just want to elevate something that Jessica said earlier about undervaluing communications. And just to give you a couple recent examples, there was a large research program at NIH to focus on disinformation that became so politicized, it's been axed.
Yep.
The CDC's budget for communications has been axed.
Yep.
Academic medical institutions do not value communications as a factor in promotions. It's all about grants and papers. So until these kinds of things change, we're not going to see communications of science, of public health, valued in the way other kinds of communication are valued. And I can tell you at the TV networks, it's all about politics and war. That's what's valued.
Yeah.
Sorry,
where
Brian.
where the federal government has failed to step in, philanthropy has. And so I hope everybody in the room goes to visit the Public Health Communications Collaborative, because we're stepping up. RWJ, Kresge, Trust for America's Health, CDC Foundation, and DeBeaumont has created this space where we are trying to put common messaging out there, where we have misinformation outbreak alerts, where we're going to have a training academy for public health practitioners around communications. We're playing catch up and we're trying to move really fast, but I encourage everybody to check out that resource, because it's built for you to help you communicate better.
Brian, how can they get to that? Because I want to foot stomp that. I want to tell you all, one of the lessons from my book is that throughout the pandemic, I did not have full-time communications help. Right. As Celine mentioned, there is not an emphasis on comms. I was not invited to the COVID conversations until mid-February. Why? Because as Surgeon General, I was seen as only being comms. And they didn't feel that that was important. To your point, it was, let the virologists, let all the scientific experts figure this out. Forget about the fact that I was actually a practicing anesthesiologist in the middle of a respiratory virus outbreak, and that I actually had run a state Department of Health. I was seen as comms, and comm was not seen as important. It was seen as happening after the fact. But to foot stomp the point that you made, I actually use your communications as the former Surgeon General to compose my health messages and my tweets moving forward, because it is more practical information. It's more field-tested information than some other agencies out there that get disparaged enough, and we're not going to disparage anymore, are putting out for me as a former Surgeon General.
So we're going to transition to our second topic. Don't worry, there's lots more to say. Information sources. So let's see what voters in our focus groups said.
So when I do research, there are two types of researches I do. One is I go to a doctor I know and trust. That's research in my mind. And my doctor has been trained and I have confidence in him. The other form of research is Dr. Google, and I agree that that is very questionable.
You've got to just do your own research, view all the sides, literally just spend a day on Google and watching everything you can and make the best decision you can for yourself.
I think not necessarily accurate information. And so it's up to me to find out what is true in the statement and what is not true in the statement.
I echo the views of skepticism that others have voiced in doing my own research. Particularly, I'd want to see if said officers had any connection with pharmaceutical companies in the past. That would be a target of my research.
I'm cynical because everything they said was wrong. 15 days to flatten the curve. Masks worked. The vaccine worked. We stole so much time from kids. We took kids' proms. We shut schools down. we just hampered a whole generation of kids for absolutely no reason for a virus that had a 99.7% survival rate. It was one of the greatest blunders that we've ever done.
So now we have a question for all of you in the audience again. Use your phones to respond. And again, the URL and QR code to connect to the question are on the screen. The question is, from what sources did your family and friends mainly get their COVID-related information? So looks like CDC is a big one. You yourselves as public health experts. Social media, Google, TV news, newspapers, anywhere but the scientific literature. State health departments, Facebook. The American Academy of Pediatrics, politicians with agendas. As maybe somebody from the tech team, if you're able to scroll through.
Brian, while they're scrolling, what was the website for the Public Health Collaborative?
It's publichealthcollaborative.org.
So maybe this will get tallied for us in a bit. In the meantime, we all know the power of big tech platforms and social media today. Dr. El-Sayed, Dr. Castrucci, Ms. Rivera, how do you think these platforms impacted Americans' beliefs and behaviors related to COVID during the pandemic? Maybe Jessica, if you want to get us started.
Sure. You know, this is one of the reasons, these answers are one of the reasons why I leaned into the platforms as a place to fill it with truth, fill it with evidence, fill it with opinion, and helping people navigate, because the fact is people want the fastest and the shortest piece of information to move about their day. They're not reading the full New York Times article about it. They're not reading the full Lancet Journal publication about it either. They want a 15-second summary. They want something they can swipe through while they're not paying attention on a work call. You know, they want something very quick, delicious, you know, easy. And so I did a lot of my science communication on social media for that purpose. And I worked with the platforms in some cases to help identify bad actors, to help elevate the voices of folks who were trying to do the good work of filling the space with truth and with evidence-based information. Some of it was very frustrating. Some of it was very, very discouraging when you would hear folks at Meta say things like, well, we can't be the arbiters of truth. And I would say, I'm not asking you to be an arbiter of truth. I'm trying to tell you somebody is selling snake oil here. Somebody is causing true harm. This is dangerous and misinformation. Then you had other platforms like YouTube that tasked myself and a number of other researchers to help create a system to mark who was reliable, who was trustworthy, and who was untrustworthy, and presented that paper to YouTube after the fact. And now they have a really great system of credential verification, which is very important since blue checks became something you could buy. Mm-hmm. And it made it much more difficult to distinguish who was true and who was not. I mean, I used to use Twitter, X, as a first round of what are my peers saying? Yep. What am I looking for to have a source behind my understanding of this? And it's become much more difficult. So it's kind of all the things, right? It's a very important tool and a necessary evil. And it can be used for good, but we also have a long way to go too in helping these platforms actually be partners in creating safe landscapes for folks to get reliable information.
I'm gonna go a little harder on them here. So we did a live show of my podcast, America Dissected, with a writer for The Atlantic and also a video game designer about public health and the internet. And we talked about the advent of AI and the way that that's going to start moving the information environment when the cost of creating information goes to zero. And his overall conclusion was that the idea of being able to arbitrate fact in information is going to become nearly impossible, and you're going to have a world of competing narratives.
Yeah.
And the hard part is that these platforms, their business model has been built on monetizing our eyeballs and our eardrums in ways that show us the things that are going to get the most emotion. And those are either things from people we like and agree with us, or things from people we don't like and with whom we disagree. And so it is created to create this cacophonous battle where everything is contentious and the overall goal is dunking on the other side. And if you've been on social media these days, that's probably your experience, unless you like cat videos, in which case that's awesome, stay there. Don't come to this other side. And the hard part about this is that one of the points that we were trying to get to is that the internet itself is a context on which public health has to think, because it's imposed a meta-curriculum that tells us that the way toward truth is fighting it out on these venues, because that way they can feed us ads to help us buy stuff we don't really need. And so we have a responsibility not just to engage on the platforms, which I totally agree with you. You need to, so long as these become a space where you can inform. But also, we need to be thinking about our responsibility as a community around social media unto itself, right? Because it's not just this mis and disinformation issue. If you've talked to anybody under the age of 25, kids are not doing great. And a lot of that is because of the way that this algorithmic sorting has created a world in which a lot of our young people are held captive, right? That is not so great for their emotional and mental health. And so I actually think that we have to get smart about asking the bigger picture. The last point I want to make here is, I worked for CNN for 3 years, and I think there was this sense on television that the media, right, big corporate media that has big signs, you can see them like right outside, that they're imposing a viewpoint. And I think the challenge with that is, you're right, there's a narrative on all of these networks. There's no doubt about it. Folks have opinions, right? The folks who are in green rooms have opinions. But that sometimes leaves us missing the way that these implicit perspectives on social media platforms feed us stuff that folks who are out there doing their research seem to think is more real because it doesn't have a big corporate imprimatur on it. And I think we've got to be a lot smarter about being able to educate about that issue, even as we think about what it means to be, quote, told things or fed things. Just because it doesn't have an imprimatur and it seems to be coming from your cousin Vinny's former goldfish's best friend, doesn't mean that it does not have a viewpoint and that you're not being fed that viewpoint for a particular purpose.
And just a follow-up question for you guys. If you look at how these different industries make their money, what the business model is, we've seen the decline of journalism and media as we've seen the rise of social media and big tech companies, right? And that's basically the shifting of ad dollars from one to the other. What is the business model today for good information? Is there one?
So I think that there has to be the pivot, right? Social media is not going anywhere. It will always exist. It will always be a primary source of information for a lot of people. And it has established itself as such. And so many of these entities, CNN included, have had to make that pivot as well, because they know they'll probably get more eyeballs on a CNN Instagram post than they will on a tweet thread or even a click to the actual website. They want it in a summary, in a square, even in a 15-second story. So the business model, I think, is moving all of the newsrooms to that as well, which is why I think the accountability should continue. To Abdul's point, like, it's not that it stops and that we don't say, hey, we need to be better at understanding what is true and what is not. I mean, I co-wrote a letter to Spotify, not to silence and censor anybody or to deplatform and to demonetize. It was truly to say, hey, can we be better about at least giving a warning to folks to say, hey, you're going to be receiving information that's related to health, when you should be asking your trusted sources like your doctor or the CDC or the WHO or whoever it is that you want to rely on, instead of listening to a 3-hour unhinged rant from somebody who intends to cause confusion. That was not received very well, because and that's putting it very lightly. We received death threats for even making the suggestion, which was, again, to not cause any sort of censorship. This is where we have a lot of work to do, I think, in helping people understand that the purpose of us having opinions about these newsrooms and these news sources and how they're monetized and how they exist is not to say it's our opinion only. It's to say there are people who you should listen to and there are sources behind them. And this is a way to help you understand how to be safer on the internet, because it is a very dangerous place when truth becomes subjective, when facts become alternative. And especially as young minds are growing up on this very digital age, I worry about people, the young generation's ability to become better consumers of that information without these types of pushbacks.
And Celine, you asked a specific question about where is there a business model for good information? There is. The challenge is that there's a lot more needles. Like, you can find great information. I mean, the notion that you can, like, you don't have to go to a library, I said this on Sunday, like, and ask for a journal and then, like, take print of the journal and then read it. You can get anything you want. The problem is there's a lot more hay.
Yeah.
And so there is a business model for good information. My grandparents, like, subscribed to Curiosity Stream, which seems lovely, right? But it's getting good information to folks who wouldn't self-select to getting it. And I think that's going to be the fundamental challenge of how do you get that good information when people aren't self-selecting into it. And I don't see the business model for that, and that's what I'm really worried about.
Well, but you all, I don't want you to forget something that was brought up in the panel that we just watched and that has been mentioned here several times. Yes, we need to focus on social media and the internet because it is where most Americans get most of their health information. Period, point blank, like Jessica said, it's not going away. However, when you poll Americans, the number one person who they trust for their health information is their doctor, their nurse, their pharmacist. And I want you to understand a couple things happened during the pandemic. Number one, the shutdown separated people who had primary care clinicians from their primary care clinician, so they couldn't ask those questions. And then they were forced to go to the internet. Number two, a lot of people in our country still don't have access to a clinician. Number three, when we rolled out the vaccines, we did them in massive vaccine sites where we told people to drive up in your car, stick your arm out the window and get a shot, not in the traditional setting where you could go into your doctor's office and talk to your doctor or nurse practitioner and ask questions and have a conversation about the vaccine. And so we need to figure out how we get people back in front of the individuals who they do trust so they can get good information, not just about vaccines, but about cancer screenings and about smoking and about vaping and about all the other risk factors that exist, because if we don't, they're going to continue to go to these alternative sources of information, and we're going to continue to get our lunch money taken from us by Joe Rogan.
But let's pull those two strings together. So people trust doctors. Social media gave rise to the disinformation doctor, people who weaponized the white coat to spread disinformation. And so now we have to deal with that, because maybe it's not that people are anti-science. Maybe it's that they can find scientists who agree with them.
Yes.
Right?
Yes.
So, you know, you wear a white coat, and Abdul, you probably have a white coat somewhere. Somewhere. And so what makes your white coat smarter than his white coat? And if you say ivermectin is great and he says it's bad, you're both scientists. And so we heard this on the focus groups. My doctor said that COVID isn't that bad. My doctor said I should take ivermectin. And so we have to really confront this disinformation movement among physicians who are using this as a grift to make money. I mean, there was a woman in Houston, Texas, who wrote something like 200,000 scripts for ivermectin. And we have to regulate that. And this is where the politics comes back in, because most state medical boards are appointed by elected officials. And I think it was in Tennessee where the elected officials said, listen, if you go to regulate COVID information, we're going to swipe the board. We'll come up with our new board who won't do that. And so this is a huge challenge. And as public health practitioners, I don't think for all the tabletop exercises we ran around pandemic preparedness, someone walked into the room and said, oh, hey, by the way, the guy with the largest Twitter following in the community, he just said this is all a hoax. Continue.
Yeah.
Right? So we need to start, we can't be afraid of engaging and being on these sites. And listen, if we're not out there with our information, someone else is going to fill that void with bad information. So if you're a health commissioner, your job, I hope you are never in your health department. You know, I want you to be out. I want you to be at the Kiwanis Club. I want you to be at the opening of the Froyo. I want you to be out there meeting with people so that they don't think, well, who is this person I've never heard of and who I didn't elect who's telling me this stuff, right? And I think you see the really successful health commissioners. We should give a shout out to Nirav Shah at CDC, who just killed it in Maine. He was on Twitter, he was engaging, and Nirav is great. He's amazing. But he filled the void. He was out there active, because if you leave a void, more nefarious groups are going to fill it for you.
The other point, I just want to pick up on the point that Dr. Adams made. The hard part, and this is where it also goes back to politics, the average primary care visit is 10 minutes.
Right.
I mean, if we're not serious about solving those infrastructural challenges that don't come up in the middle of a pandemic, we are creating a space where even the folks they say they trust, they cannot see because the economics of healthcare make it nearly impossible to do, right? And so we've got to be serious about connecting these two. And one point, just because we have a public health audience, how often when you hear the word healthcare, so somebody says, oh, I'm in public health, and you say, there's like, oh, cool, so you're a doctor. You're like, no, healthcare and public health are not the same. Here's the problem. Most people are gonna see you the way they see healthcare. I'm sorry to say it. Yeah. You should keep telling them you're different, please do, but you're fighting a losing battle. And the truth is, unless we're willing to engage that other side in healthcare and call on them to be better, right? We're gonna keep sitting downwind of what it is that they do. And we've got to get serious about fighting those big battles too and informing those battles. And I think sometimes we see that space, right? Because we say they're not the same, but so much of how people trust or don't trust what we say is how they trust or don't trust an encroaching hospital that may be run by a for-profit that is like squeezing out any time that they get to spend with their doctor, every time they got to go to a pharmacy and pay a gigantic copay for something that should be free. Right? Those issues are our issues too, and we can't cede that playing field.
So most of our solutions to disinformation are at the end of what I would call the information supply chain. So simply speaking, you have raw data that gets processed and then disseminated. Our solutions tend to focus on moderation, debunking. So again, the end of the information supply chain. Is there more we could be doing earlier in that information supply chain to combat mis and disinformation? Jessica, I'd like to start with you on this.
Yes, big capital yes. And it grieved me and probably many in this room when I think it was the director of the NIH at the time who said something like, I wish we were more prepared for it. I don't think we were prepared for the misinformation, the mistrust. And we're like, what? We have been screaming about this for decades. And there's this anti-vaccine playbook that is just copy paste anytime there's any public health situation. It's very unoriginal, but it is very effective. And the level of sophistication has grown because, let's be honest, this is an industry, not a movement, to discredit science because they have so much money to make in this grift.
It has a business model.
It has a business model, and we have to call it what it is. It is an industry, it's not a movement. It is not this, we used to be able to say it's a quiet minority. It is much more than that now, unfortunately, because of the pandemic, because of the politicization of public health. And so when it comes to this process of thinking about public health as a system, it works when it's invisible, right? You know, it's behind everything. It's this well-oiled functioning machine. And you don't build a fire station when everything is on fire in the same way that we can't just rely on debunks and demystification after the fact. It is a investment, and it is an expensive investment in public health and public health infrastructure, and including communications at the very beginning of every single one of these systems, and saying a public health department at every state and local level cannot exist without somebody who's going to be specifically tasked with, and not just, oh, you're free, can you write the comms message on this? Somebody who's trained in science communications, somebody who understands the discernment of when to debunk and when to do a truth sandwich and when to do a logical fallacy explanation. It requires so much investment from the very, very beginning so that there's a steady stream of everything from information to debunks when they're necessary to responses and mistakes were made, and honestly, a lot of humility. Because at the beginning of a public health emergency, for instance, there's gotta be a statement that a lot of us in this room and a lot of scientists are not comfortable with, and it's, I don't know, or we don't know yet. The data is evolving, we still have a lot to learn. be patient with us as we are being patient with this emerging situation. And that just felt like too much of an ask for folks. It just felt like we needed to come in hard with a heavy hand of science and say, trust the science, which is a meaningless sentence. And it caused the beginning of this binary thinking of it's red and blue, it's left, it's right. And that is proof that we need it from the very beginning.
The biggest plea to all of you all in the audience, to every single one of you all, is we need more Jessicas. We need you all to support more comms help in health departments. We need more comms training in schools throughout. I got no comms training in medical school. I got my MPH over 20 years ago. I didn't get to have a single comms class when I got my MPH. I've run a state health department. I've worked for a local health department. I've been Surgeon General of the United States. And I can tell you that the most important aspect of any of those roles, when I was in any of them, was comms. It wasn't my medical information. It wasn't my infectious disease training. It wasn't, it was comms. And that was missing from my education throughout. And I had to learn on the job. And you all saw me and many others take our lumps trying to learn on the job. But there are professionals who do this. They can sell an Oreo cookie to any kid in America, and they know how to micro-target, they know exactly what messaging to use, but yet we can't figure out how to get kids to get an HPV vaccine that can prevent cancer. We need to leverage the information and the science that's out there on communication the way we try to leverage the information and science that's out there in many other different ways.
And this is the time, because we have the public health infrastructure grant.
Yeah.
So we all should be posting comms positions, because otherwise it's kind of hard to fund comms positions inside your health department. I have a diabetes grant and I want to get the most bang for that buck, and comms doesn't fit in. Or I have this immunization grant and I don't put a comms person. Or really progressive and thoughtful health departments should start to make sure that every grant you write to the CDC has a communications person there for some portion of time. And then you aggregate that up. But right now, with the $3.2 billion from CDC, we have an absolute opportunity to really do this. And I encourage everyone to go to the de Beaumont booth, because we have a book that helps people with their communication called Talking Health. And I think if you go like later today, we're giving them away for free because we don't want to pack them up and bring them back to Bethesda. So come help us and help you by grabbing a copy.
Mayor Fisher, picking up on something Jessica said earlier about being able to say you don't know. Could public officials have done a better job of communicating uncertainty? So for example, about masks or closing schools or vaccines, could they have done a better job with that?
Well, you can always do a better job. And I'm married to a physician, and she got very ill right at the very beginning of COVID. I thought she might die. 13 days of really sickness, and she's a strong Greek woman. But she said there's a reason why it's called the novel coronavirus. You know, and most people, what do you mean? It's like, well, we don't exactly know what's going to happen here. But we want to give the best advice we can to try to save as many lives as possible. And that goes back to repeat what I said earlier about bringing all the best minds of the community together and just saying, what's our incentive to lie to you? Mm-hmm. I mean, we're just trying to save your aunt, your grandmother, and people that you love. And we all know how it impacted older people to start with. It did kill millions of people. I mean, that's irrefutable. So approaching it with humility, but with tenacity is important. As you all know, this was no joke. Mm-hmm. And to treat it in any lighter manner, I think, would be, certainly a disservice to the roles that you had. And we're just in this time in our country right now, which I think is kind of the bigger issue. So much of what we're talking about up here, if people had basic critical thinking skills, that they would say, well, what that person is saying doesn't make any sense. I can understand if 5% of the country thought that, but not 49 or 52%. So, what's with our education system? Why are we having emotionally fragile young people in our communities right now? So while we fight these battles up here on public health, remember there's much bigger issues that are at play that are causing us these problems that I would encourage everybody to keep in mind, and again, advocate for better education, better health care, better emotional treatments that we have, mental health in our society. So it all flows down to when we have a crisis, that's when you see the real personalities emerge, And boy, there's a lot inside of people that maybe we weren't quite expecting, but it wasn't pretty.
A big plug here for the CDC and for something that you also all need to really talk to your legislators about, and that's data. So I tell this story in my book. President came in the Situation Room in March and said, how many people in the United States have COVID right now? We don't know, Mr. President. How many people are hospitalized with COVID right now? We don't know, Mr. President. How many beds do we have available? We don't know, Mr. President. And then he said something in typical Donald Trump fashion that I can't repeat on stage. But the point is, we can't communicate effectively and in a way that is appropriate to America if we don't have the data and reporting infrastructure to be able to slice and dice. We lost our credibility when we told people in Boise, Idaho, you need to shut down, and they hadn't seen a single person with a case because New York was imploding. But we didn't have the data to understand, okay, the actual case burden is very different in Boise, Idaho than what it is in New York City. So we made massive general recommendations to everyone because we did not have the data. And the CDC has not had the authority to collect that data. We actually declared the public health emergency. Data reporting went from like 30% up to 90%. And that drastically changed our ability to actually understand what was going on and communicate with people. We lost a lot of that when the public health emergency ended. And I don't think people in Congress understand that a lot of the communications issues that we had were because public health data reporting is terrible. Again, I've been a state health commissioner. Most of the data I got as state health commissioner was 2 years old. The way we do public health is we drive down a dark road at night and we wait until we hit a speed bump. And that speed bump is usually a dead body. And we go, oh, that dead body was on the left. I guess we better turn right. That's how we do public health. We need to do a better job. We need to demand better data infrastructure so that we can be better and more effective communicators.
Well, and I will die on this hill because for the first 18 months of the pandemic, I was at the COVID tracking project, which had to exist simply because of this issue. Mm-hmm. The fact that we couldn't rely on the federal government to provide not even data standards so that the states who were doing it on their own, because they truly could not be forced to do it, the CDC is powerless. It can not compel a state to follow anything. But without standards, it was so hard to normalize the data, to standardize it and to turn it into something that was actually useful for a place like Boise compared to a place like Los Angeles or compared to a place like New York City. You could not make sense out of total tests, test positivity, the death rates. The only thing that was the closest to real-time data was hospitalization. Mm-hmm. And at 18 months in, we realized we can't keep doing this. It was an 800-person volunteer organization. Mm-hmm. And we were doing the job of the CDC in the absence of the CDC for a long time. And I have empathy for the CDC at the same time because you're dealing with an infrastructure that is so overwhelmed mm-hmm. and outdated. Yep. And I'm cautiously optimistic about the data modernization efforts that are going on, but this is why public health is political, because how can it not be if you don't have good data to inform it?
Decisions.
It needs to be there.
And the political will to invest in it and also collect comprehensive data. I'll quote Dr. Rebecca Gee, who was the health commissioner in Louisiana, who recently was on 60 Minutes talking about some of the challenges with maternal mortality. And she said she was under pressure as a health official to suppress data on race.
Yep.
Because that would have political, partisan implications. Let me ask you guys this. Are public officials, including public health officials, applying the lessons that we learned during the pandemic with respect to communication today? So for example, with respect to youth and mental health or gun violence, are they applying those lessons?
Let me jump in as a sitting public health official. I think on the one hand, there is a recognition that we could have, should have, and in the future that should inform. On the other, I think about a department like ours. We oversee health and human services for 1.2 million people in the largest and most diverse county in Michigan. And we are still licking our wounds from the bureaucratic and infrastructural damage of the pandemic. So this is the time where we ought to be out in the community investing for the next one. Mm-hmm. But what's stopping us from being able to do that is we have to actually address everything that went wrong. I mean, recent headlines about congenital syphilis. right? And we know that that was a displacement issue. All of that contact tracing that should have been done on syphilis did not get done because it was being done for COVID, rightly so. But now you're looking at a department that's been ravaged. Your morale is at an all-time low. People are deeply frustrated if they haven't left already, and you're trying to hold the thing together. And so that leaves you sitting in your health department, having internal meetings about this and that versus out in the community, building trust and getting to the next one. And a lot of that goes back to funding. And I'll be honest with you, our county executive and our county commission has been amazing at funding a health department. There's only so much you can do, right, from a county. A lot of that has to come from state and federal government. But because, right, we've kind of all wanted to lock that door on COVID and kind of move on and pretend like everything's normal and nothing really happened, right? You have one-time ARPA funding, but that's about it. And so what can you really build in terms of infrastructure? So I think a lot of folks are sitting here with the dissonance of saying, I really would love to be able to go out, have a real robust community engagement approach, but I don't have the wherewithal, I don't have the morale, and I certainly as hell don't have the funding to be able to do that in any consistent way. And so it really does catch folks who you know the right thing to do, but you're kind of stuck trying to rebuild from what just happened.
Are we applying some of the lessons to other public health problems today?
I'd say no, and I think it's critical that we think about this going into Thanksgiving, meals around the dinner table, going into Christmas holidays, meeting up with Uncle Joe and Aunt Sue. And I'm going to take it a slightly different place, but it's one of the major points, again, that I make in my book, is that we continue to allow politics over principles and pragmatism to actually influence the way we frame and talk about certain issues. And so this is an issue that's near and dear to the mayor, and he may disagree with me, but I want to make sure we talk about this. July 2020, Donald Trump announces he's going to hold a 4th of July rally at Mount Rushmore. Public health loses their minds, and understandably so. And so I have to go on the news, and they say, Dr. Adams, can you come on the news and tell people how to stay safe for 4th of July? That's the way you frame it to me. We just want you to tell people how to stay safe. So I'm sitting in the green room. Donald Trump is going to hold a massive super spreader event. Our medical experts say it could kill thousands. Coming up next, Donald Trump, Surgeon General, to explain. And that's how they introduced me, to go on the show. So I go on the show, and I say, Dr. Adams, won't you condemn this super spreader event that Donald Trump wants to hold? And I say, look, I want everyone to understand their own personal risk. I want them to understand the risk of the situation they're going into, and I want them to make a smart decision for them. And I walk them through assessing personal situational risk and then making your own decision. I said, but at the end of the day, it's not my job to tell people, to condemn people for choosing to go see the President of the United States. I got ripped to shreds. For those of you who didn't see, Axl Rose, Guns N' Roses, called me a piece of shit. It was trending on Twitter. Don Cheadle, an Avenger, came after me. Some of you all in this room attacked me on TV. But here's what I knew. I knew that if I had condemned people going to see Donald Trump on that left-leaning news station, I was going on Hannity the next night, and I was going to have to explain why it was okay for people to go to a Black Lives Matter rally or a George Floyd rally, because somehow the virus knew the difference. And so I say that because we still continue to frame these issues through a partisan lens as opposed to pulling back and trying to say objectively, here's what the science says, here's how you should think through this issue. And it's okay to hate Donald Trump. A lot of people do. But when you put on your health hat and say, you have to vote for this person or that person, you just got to know that I'm not going to tell you you can't or you shouldn't, because unfortunately we have a two-party system in America, and it does come down to a choice. But I think you can have those conversations without being so explicit about leaning in for one candidate or the other. People are not stupid. I mean, they can reach that conclusion. And I think we still continue to frame all of these issues in a way that makes people think you're demonizing them, their beliefs, their party, their particular candidate, and then you lose your credibility as a health official. And Brian, you and I talk about this all
To
the
your
time.
point, Jerome, I think the media does bear some responsibility here. I was asked about those same rallies, political rallies in the summer of 2020. Was it okay for spring breakers in Daytona Beach to be on the beach? And I was sort of like, they're outside. It's probably fine. This is not what you should be worried about. But there are questions that are sometimes asked in a very loaded way that frankly gives very good reason for the public not to trust the media on some of these things. We're going to move on to the next.
Just to add one point to what Jerome said. I know, Jess, you were trying to get into, so we can get you in. But it's about values over science, right? So Senator Hawley, in congressional hearings, was lambasting DC officials on the fact that they allowed the George Floyd protests while simultaneously not allowing outdoor church services on Sunday. You can't do both. Because we showed the Josh Hawley clip in our focus groups, and everyone's like, well, you're hypocrites. So we lost that ground because we led with values. Now, I think we should have done the George Floyd protests and allowed folks to then have outdoor church on Sunday. Because as you said, the virus wasn't really picking and choosing where it wanted to go. But this is where, like, us public health practitioners, we have to figure out, do we want to be idealistic or do we want to be impactful? And what does that mean, right? And how do we use our language? I mean, Abdul and I were talking yesterday about us being linguistic absolutists, right? That we want to use our language. Yeah. And if you're not with our language, if you're not willing to say health equity everywhere in the most conservative, deep red place.
If you're not willing to go into the super white, male majority Indiana legislature, and many of you all have called me out on this and say, you're all a bunch of institutional racists, then I'm a bad guy. You know, I mean, that doesn't work. That doesn't work.
Can I, because I did tear you up, I'm sorry. Like, I'm actually not though, but like, because you brought up the very wild elephant in the room. And I think one of the frustrations here is that, to the point that you made, Brian, we end up looking like hypocrites, in large part because we have assented to defining public health at the least common denominator of what it is we tell people to do. And then people believe us to the extreme, right? You should wear a mask, you should take a vaccine, and folks are like, no, absolutely not, never, and I'm not even, if I could pull the first vaccine I took out of my body, I would do that too, right? And then others are like, I will wear a mask to sleep outside. And I'm just saying that, like, part of that is the internet machine, right? Part of that is our own polarization and the admixture. But part of that is our own willingness to let public health be defined in its most narrow terms. And I think the issue here that we all should be talking about isn't what we told people to do or not to do, right? The recommendations that we gave. Because I think you start to get twisted in knots because there's all kinds of competing values. I think what we should have been saying from the jump, and should still be saying today, is that public health is a thing that you invest in and that you do well at baseline, and that allows you to toggle with and engage with systems and institutions that protect us beyond simply what it is we're doing. I mean, the notion that, like, there isn't a broader conversation about how we keep indoor air quality safe post-pandemic, right? The notion that we're not really investing in serious ways beyond the CDC infrastructure grant. I got all kinds of issues with that. CDC folks, I'm coming for you. But even beyond all that, right? There is broader, big time investment that ought to be made. And I think we've got to be a lot smarter about recognizing that our messaging isn't just about what you do right now. That's important, don't get me wrong, but you lose that battle when you're not investing in the institutions and the systems that ought to be there in the background keeping us safe. And I think we miss that boat too often, and then we end up with a real brand problem because we're just the folks telling you what you can't do. And that's never going to be effective for us.
Jessica, jump in, because we don't want to be accused of
final word on this, Jessica.
Yeah.
We can keep going because we only have a few more minutes. It's fine.
But you're the comms expert. I mean, seriously.
I mean, yes, I agree. And I think I was actually going to mention, as somebody who doesn't really lean into optimism much, an example to your original question, which was, have we seen it applied in other public health issues? And I do think we did with Mpox. I do think that there was a really pretty incredible pivot to early comms, early harm reduction language, using social media as a way to fill the space of, what is misinformation, what's disinformation about sexual health, destigmatizing some of the language. It was a very imperfect response, don't get me wrong. But I do think, to answer the original question, that there was, and I am excited to see that continue to be a reflex of, okay, how can we address this early? How can we get ahead of the, the information issues? And also, how can we not make this so binary? It's not everybody stop having sex. It's how can we reduce harm, which is kind of the basis of public health.
So we have one final video clip which focuses on the topic of rebuilding trust. I think myself, trust is the flip side of disinformation. Let's see what this focus group of voters had to say about trust.
I think of systems that are underfunded and aren't well researched at the local and state level often. And then at the federal level, I think there's too many different agencies and I don't really know who's in charge and whose information is best on the best science and who to actually listen to.
Why weren't they honest with us and say, we're not really sure if this is going to work or not, but we'd really like you to try because we're lost and people are afraid and we don't know what's going to happen. They weren't honest, so I don't trust them.
Only way to get my confidence back is for the federal government to admit what they did was wrong and admit that they were pressuring states and local doctors to do what they wanted. Otherwise, they would cut them off. I know doctors who were fired from hospitals because they did not follow the anointed policies. So I've lost confidence, and you can't get confidence unless you admit your mistakes and say, we did this wrong. We did this, and this wrong, and we lied to you. I feel I was lied to by the government in COVID. I won't trust anything they say in health anymore.
If I were to ask the public health person, right, if I'm trying to trust them or not, my question would be, what are you and your family doing? Not what you're telling me to do. Yes. What is it that you are doing in this situation? That's what I want to know.
I feel like one thing that would convince me is if I heard the study, as you said, of 19 unbiased, unpoliticized scientists or doctors come together and they said, 17 of us agreed that you should take the shots, 2 of us are not sure. That they release the total results of how everybody feels, so that we understand that not everybody believes the same way. That would make me feel like there was a lot of transparency going on.
So we have one final question for all of you in the audience. Use your phones again to respond, and the URL and QR code are again on the screen. Our final question is, in 3 to 4 words, what can the field of public health do to rebuild trust in communities?
And as you're doing that, we're running short on time, so I just want to jump in really quickly as you're replying and say that I completely agree with the gentleman who said we need to do a better job of walking the talk and helping people understand what we do. As a physician, the one thing that I always, when I'm giving people the pros and the cons of a particular procedure, I always finish with, if it were me or for my wife or for my loved one, this is what I would do. It's why I'm so present on social media. I posted a picture of my daughter getting her flu shot and her COVID vaccine on Saturday before I came out. And again, half the people told me I was a terrible parent for giving her the vaccine. The other half told me I was a terrible parent because I didn't make her wear a mask while she was getting her vaccine. But public health is messy. Making these decisions in the real world is messy, but we need to help people understand we're not perfect. We aren't expecting you to be perfect. This is what we do for ourselves. And I think that's the one thing that we can do that will help restore trust and credibility is helping people understand how we navigate these situations.
Mayor Fisher, how can public officials help rebuild trust in public health? In particular, when many Americans don't feel they're being served by our health system?
First, have high expectations for yourself and your departments. Know that you're critical community leaders. It's easy to feel a little shell-shocked by these last couple of years. We can't afford that as a society. And know that you do have a position of respect, and exert that with competence and knowledge in the community. Work with your healthcare systems. Bring them back together as you can to speak as one for the community. So this is moment when we need you to be speaking out on what's next and how we can prepare ourselves and make public health personal.
Abdul, how can decision-making in public health be made more transparent and accessible for the American people?
I think when you think about any program or piece of a department, ask yourself, what is the community adduct to that thing? And how are you engaging communities around what you're producing, around taking feedback about how you've performed, and then what they would like you to do next. I think the other part of it, though, is, as a culture, like, there are so many things about the public health community I really love, but like, we love to shame people, and we love to signal, and we gotta stop doing that. Like, whether it's locally or it's as a community, the number of times I've tried to explain something, and I'll get somebody who's probably well-meaning, but also like loves the Twitter incentive of like being able to dunk, like whenever, be like, well, you'll miss this really important detail. I'm like, well, I was taught that when you tell people everything, they remember nothing. And when you tell people something, they remember something. So I'm just trying to make sure people remember something rather than trying to explain to you that I know everything, so you don't dunk on me later on, because that would be useless. And I think part of that is just adapting that culture as a community where it's not about proving ourselves right or proving you wrong, even worse. It's about getting you to right. And that could be a process. It may take 5 minutes, it may take 5 hours, it may take 5 years, right? But we're willing to walk that path, and we're building a space where you can trust me and trust us, right? And understand why we are continuing to have that conversation. I think we miss that part sometimes, especially now, because I think so many of us feel so defensive, and that doesn't allow us to really engage the posture that we need.
Shame is almost never an effective engagement strategy. Almost never, but we use it far too often.
So rapid fire round, starting with Brian. Any last takeaways for the audience?
There's a lot of work we have to do. There's going to be a session later today on an infodemiology training program to start to infuse this idea into our health departments. The future of the health departments is not doing what we did before COVID, just more of. It's a whole different way to do the work. And that's our challenge leaving this conference. How do we do it better? How do we do it differently? How do we rebuild public health?
Mayor Fisher.
Embrace your leadership role. Look, you didn't get into this because it was easy. And you might feel a little shell-shocked, as has been said up here. That's mainly inside baseball. Most people have moved on with their lives. They like competence, they like confidence, they want to see you in your communities. Get out.
Indiana is one of the reddest states. We were able to expand Medicaid, we were able to legalize syringe service programs, and we were able to increase public health funding by 1,500%. So anyone who tells you that it can't be done or that it's inherently partisan is not telling you the truth. And so I want you to think beyond that. I want you to think who you can bring to the table. I want you to think about how you can make the business case, and as Jessica says, not be afraid to code switch to actually speak to your audience. That's Comms 101. Understand your audience and speak to your audience. And check out my book, Crisis and Chaos, because my publisher would kill me if I don't, and I'm not making any money off of it. I'm donating all profits to buy books for other young people if you get it. But I talk about all of this in my book, because it truly was a crazy last couple of years, and I still worry that we aren't leveraging the lessons learned to the extent that we could or should.
I would say that this work, the work of science, the work of public health, is not finished until it is communicated with empathy and with good examples. And I think that we have a lot to learn when it comes to the way we can show up as scientists, not just as scientists, but as humans and as members of communities that we are talking to. We are all part of communities, and at the basis of public health is community. And a plug myself for a documentary called Shot in the Arm, which I think is going to do a really, really, really big thing in showing the healing and progress that can be made on what we are going through right now in this kind of anti-science, post-truth world.
You know, I was a public health official, once in future public health official, but between then I ran for office. And one of the best pieces of advice I've got is, and I took myself, was say what you're for. Spend a lot of time saying what we're against, and what people shouldn't do, but we don't spend as much time saying what we're for and what we're about and who we're here to serve. And I think as we engage our service, reminding folks what we're for and why we're here, I think can orient us to the upside of what it is yet that we can build And the future is really ours for the building if we're willing to step in and build it.
Well, thank you. And let's give a round of applause to our panelists.
Let's give a round of applause to our moderator because she was herding cats up here.
Thank you. Thank you. We appreciate your expertise, your vulnerability, your thought leadership, and your candor. I also want to thank our audience. Your engagement and willingness to share your thoughts through the platform has been very useful and was very much appreciated. Two of our panelists, Dr. Castrucci and Ms. Rivera, will be available to speak with you and answer any other questions you might have during the coffee chat, which immediately follows this session in the foyer of this auditorium. So please join them there to continue this discussion. And thank you, everyone, and continue to enjoy the conference.
It's great.